I'm Tracy Dieckmann. I'm a family medicine physician in Central City, Nebraska, and I've been in Central City for 6 years now. Did my training, went to medical school in Kansas City and residency for family medicine then in Wichita, Kansas, and then have been here since then. I'm from a small town originally in western Nebraska, and my husband's from Lincoln, and so we were looking for a place that was kind of in between those two locations and just really fell in love with the community of Central City and the other providers that are there and the team that's working. And it's been a really great fit for our family. So in Central City, there's a group of physicians and physician assistants, and we take care of the clinic, the outpatient family medicine clinic, the emergency room, and our critical access hospital, along with a few different nursing homes. So we see patients in all of those settings. We are the only care team in Central City. So we've seen COVID in all of those settings. We've seen it hit our nursing homes, and we've seen it obviously in our outpatient clinic, emergency room, and inpatient hospital units too. So we started operating a COVID drive-through clinic early on in the pandemic, and so that we were really looking for a way to be able to continue to care for patients who needed things that were not COVID related, because we saw that as a huge gap initially. So we carved out a different area for a COVID clinic, and we've been running that now very smoothly throughout the pandemic. We got to the point where we almost thought we could close it down, and then unfortunately here we are, full stream, busy as we've been ever in our COVID clinic currently. And then we also obviously take care of patients in the ER and hospital. We've had inpatients for COVID at different times as well. So we've just seen the whole gamut of that. Everybody who comes in, from somebody who's been exposed with mild symptoms up to patients in the ER that we've intubated and transferred out and never made it back home. So we have had that whole gamut. We've had a fair number of patients who developed COVID in one of our nursing homes who we helped, pass through that, and some of them came through and others did not. So every once in a while I get somebody who comes in specifically to ask about those questions, but more often than not, I usually am the one starting that conversation. And so I'll ask people, I try to ask, just simply, hey, if you have any questions about COVID vaccine, is there anything that I can answer for you today or help you work through? I usually try to tell people I'm not trying to get in a debate with you. I'm not trying to get in a confrontation with you, but I seriously just want to answer your questions if I can. So what questions do you have about it? Or what hesitations do you have about it? Or how can I help you get it if you want to get it? It's a large volume of different things, but I have people who ask a lot of questions about, they're concerned about whether or not they've had COVID already. Do they need to get COVID vaccine if they've already had COVID, or they've tested positive for their COVID antibodies, and so they don't feel like they need to get their COVID vaccine because of that? And my response to that usually is, we do think you have some protection from your COVID that you had a past experience with. How long or how robust that ability to fight COVID in the future is, we don't really know, but there probably is some. We think you cannot get COVID within about 3 months. We're pretty convinced nobody can get a repeat COVID infection, but as the virus mutates, as we see new strains, we don't really know how people's immunity wanes after that, but it probably does. We can measure that, and we can measure whether people have antibodies or not, but whether they have antibodies at levels that will protect them, we don't know. So I usually respond to people in saying that getting your COVID vaccine does nothing but actually just help that immunity even more. So there's very little risk in you getting your COVID vaccine. Almost, I would argue, hardly any risk in getting your COVID vaccine, whether you had COVID before or not. And if you had COVID before and then get your COVID vaccine, then you really should do well in the future as far as potential exposures coming up. There's still a lot of people who are concerned about safety. So I think we talk a lot about that. We talk a lot about people, what they've heard from others who've had their COVID vaccine, and whether or not they got sick from it, or whether they had side effects from it, or whether they, there's a few people that want to draw really dramatic correlations between their COVID vaccine and life-threatening illnesses or even death. And so we talk a lot about what correlation means versus causation, and we talk a lot about what the chances of dying in the general public is from a cardiac arrest. sudden death, if you will, for an unknown reason in the general public versus what that looks like in the vaccinated population. The number is significantly smaller in the vaccinated population than it is in the general public, but it happens in both. And so I think a lot of times when those things happen, it's obviously hard if somebody dies unexpectedly, and we look for things that might have caused it. And we naturally look to things that correlate it, but correlation with things do not equal causation. And so there still are a large number of people who've died from COVID, been hospitalized from COVID. And even if some of those cases of death ended up being related, the number is significantly smaller than people affected by the COVID itself. So again, those things don't really equal any significant risk in getting vaccinated, in my opinion. So we talk about why we suggest things for people, why we suggest treatments or things for people the way that we do, and look at studies and how is research done in medicine. And so when we look at what's the best thing that we know for people's safety and reducing their what we call morbidity and mortality, meaning their rate of death and their rate of having a significantly impactful event on their health, like a heart attack or a stroke. What are the things that we can do to prevent that? And so we do so by doing, the best studies are what we call randomized controlled studies, where they're blinded and placebo given, meaning there's a large volume of people that are divided into 2 or 3 groups. Some of those people get the treatment and some of those people get placebo. Now the people getting the treatment and the placebo don't know which they got. And often the doctors administering it don't know which they're giving. But the researchers know, and those people then are measured and followed over time. And so we can track, does one group do better than the other? And so that's the major studies that were used for all of the vaccines that were carried out in that fashion, similarly to how we carry out drug studies for treatments for cancer, for heart attack, for diabetes, any of those things. And so when we make recommendations as physicians about this is the treatment we recommend for you, that's why we make those recommendations. Those are the studies that we're leaning on. Those are the results that we're looking at. Is we know based on those studies, which are typically thousands of people, that this group does better with this drug or this treatment versus somebody who got placebo. And so that's where the vaccine, all of the EUA and FDA studies came from, randomized controlled studies on COVID vaccine, just as they do for other drugs. Being a doctor in general, and especially in a small town where I know the people really well that I take care of, is a huge privilege. And it's like, that's really what got me excited about medicine and family medicine and small town medicine, is that these are the people that I go to church with, that my kids go to school with, that live across the street from me. And those people are my friends, and they trust me to be their physician a lot of the time, which is a huge privilege, one that we don't ever take lightly. And so when it comes to making recommendations for anything, I have no desire other than just to do the best I can for them, because I love these people. They're part of my community and I'm part of their community. And so there's no other motivation than to take the best care we can for them. And so when somebody comes in to see me, for whatever that is, if it's for their diabetes or their cancer screening or their high blood pressure or whatever that might be, and we wear a lot of hats as family physicians, especially in a small town. We want to do everything we can to keep them safe. I tell people that all the time. That's my number one goal, is to keep you safe. And I don't take that lightly. That's a thing I study a lot for, I work hard for. And so when people come in and they trust me to do that, I feel really honored by that. And so a lot of times we have a lot of tough conversations. I try to do the best I can to educate people on why I recommend things the way I do, rather than just recommend them. That's something that's different in medicine now, is this is very much a communication, a conversation that we have between myself and my patients, not just me telling them what to do, but understanding why I would suggest something and then helping them to make a good decision. And it's no different than it is with any of those things than it is for COVID vaccines. It's really frustrating as a physician when we have that trust, and I feel like I have a really good relationship with that patient, and they trust me to take care of so many of these really important things about their life. But then we turn the conversation to talk about a COVID vaccine, and all of a sudden that kind of goes away. And they maybe just say, well, I don't think I want to do that. I want to trust so-and-so instead, who maybe this is something they've read online, or maybe this is somebody else that they know. Or there's a long list of people that are in their ears about not getting the COVID vaccine. And I get that. And it's really hard to not listen to that and to listen to what your healthcare providers are saying instead. But again, know that we don't say it because we have any other agenda than to keep you safe, and to take the best care we can of you. So when you trust us to do that for all these other aspects of your life, it only makes sense to me that you would trust us when we recommend you get vaccinated as well.